This is a story of a 37-year-old female with diagnosed breast cancer, initially in January of 2014, stage 2B at the time, that was treated conventionally with mastectomy, and further she opted out for alternative therapies, and unfortunately the alternative therapies that she received failed because they were not scientific. And unfortunately, she had the recurrence of disease in September of 2015 with several metastatic lesions that was found in her bones, as well as her chest and her femur and sacrum, as well as the mediastinal organs and lymph nodes. She had significant metabolic activity in her PET scan when she saw us in November last year. As I said, she had already failed the therapies that she chose all over the world, including Mexico. So she saw Dr. Perez and tried immune therapies and other modalities. She was also seen at Cleveland Clinic. She's from Ohio, and she was counseled that she has a year to live, and unfortunately there is not much that they can offer because her disease was so progressed and it was widespread. She saw me in November. Immediately we drew the labs and ordered a staging PET scan, which confirmed the findings, and her cancer was just going so quickly, and she was very desperate and disappointed, and she really didn't have much of an option. We started her on the treatment, epigenetic IV therapies that I have designed, along with some targeted drugs that we found to be effective in her case in combination, and we were able to get a drastic response in a matter of just a few weeks. Her labs were repeated in a matter of 2 weeks and then 4 weeks, and we found that there is significant reduction in her tumor markers. We restaged her with another PET scan as we speak, that the results showed up to between 90 to 100% complete or near complete resolution of all her cancer, primary and metastatic lesions everywhere. So bone mets, the primary breast, chest, mediastinal involvement, sacrum, everything completely either resolved or had near complete resolution in the scan, which is something that we generally see in almost every patient that we treat. So it's not an unusual finding for our patients, but as far as conventional and standard expectations from somebody with stage 4 cancer at this stage and level is unheard of. And so she would share a little bit of her experience with you. She is happily back home in Cleveland, and we're planning to see her on a maintenance regimen, which would be only once a month. Thank you, and look forward to see her better and better every day.
Hi, my name's Kelly Amon, and I came to the Pacific Medical Center of Hope for treatment of recurrence of breast cancer. I had previously done treatment on the more holistic, integrated side and had achieved success, but it came back. So I know now that we were missing the source of the problem, which unfortunately I think conventional and a lot of alternative therapies do. But in Dr. Nezami's hands, we're really getting to the source of all issues, and I have every confidence that he's going to take care of this for me, and I'm going to live a long and healthy life. I've seen great results. I've been coming to him now for a few months and have seen all my test results move in the right direction. But more than anything, the peace of mind, the hope, the spirit of this place, and the way he runs his practice are what I think every patient deserves. There is a care and a kindness and a dedication to achieving results that I have not seen anywhere else. He and his entire staff are committed to each of his patients. You become part of a family in many ways, and I couldn't imagine doing this any other way. I travel all the way from Ohio for my treatments. Where I live, there are a number of top-rate medical institutions, and yet I choose to come here because he is the absolute best. I would recommend that anyone who is facing cancer diagnosis at any stage seriously consider coming here. It will save your life.